Why are you closing hospitals? Why are you putting A&E into one town?
Are these changes just to cut costs?
Haven't you already made your minds up?
At the moment, we deliver an emergency care service on 2 sites at Huddersfield and Calderdale. This means that both sites have to be available to manage anything that comes through the door. What's important to remember is that the emergency department is not a standalone unit, so there are acute specialties, things like surgeons, medical experts, intensive care doctors, who all need to be available just in case their expertise is needed. So by having everything in one place, it means patients can get the care that they need when they need it. We're not closing one hospital, we're not closing one department. What we're doing is we're making one purpose-built emergency centre for the people of Huddersfield and Calderdale. As well as that, we will have facilities on both sides to look after the majority of patients who attend A&E as it is now. So there'll be an urgent care centre open 24 hours at both Huddersfield and at Calderdale. Things that you would normally walk to an A&E department with, for example, an injury, a wrist injury, they would still be seen at the urgent care centres on both sides. That would be staffed by nurse practitioners who are trained in the management of minor injuries and also supported by doctors who are trained to manage minor illness and ailments, and also to be able to manage those unexpected people who turn up who happen to have more significant problems. The majority of the change would be for patients who come by ambulance with potentially life-threatening illness, but those are the people who have also got the most to gain from seeing an expert when they arrive. The model that we propose, all those ambulance patients from Huddersfield and Halifax would come to the one emergency centre at Calderdale Royal Hospital, where they would be met by a team of clinicians who are expertly trained and competent to manage anything that comes through the door, supported by all the specialities that may be needed at any one time. So they would start their emergency care in their own home, and that would go right through till they got to the hospital bed or the operating theatre as needed. The other thing that we'd have on Calderdale Royal is a dedicated paediatric emergency centre. So that's an emergency department purely dedicated for children, rather than lumping them in together with adults as we have to do now because we're unable to do it on 2 sites. The reason that I feel it's the right thing to move both emergency departments into one is because it provides the best quality and safety of care. From an emergency medicine perspective, it doesn't save any money whatsoever, other than the improvements that it makes in terms of mortality and the survival of patients after they've been through our service. So in terms of sustainability and moving forward, it allows us to have one strong, solid, safe, effective service for the people of Huddersfield and Calderdale for years into the future. I would suggest that members of the public get involved in this. They do have an opportunity to have their say, and they can do that through the survey that's available on the website. Surveys will be available in community establishments, your GP surgery, libraries, places like that. Read the information, ask questions and give their views. That's what the consultation is all about.